Hello friends, today we are going to do some quick references on Phlebotomy NHA 2026 exam. So this is a walkthrough of our cheat sheet and let's go through this. So first let's learn about the big three order of draw. So there are some mnemonics that's been used for easy recollection. So first and foremost is how to prevent the cross-contamination of the additives. So you are supposed to be following a strict sequence and you could choose to take any of these versions, the mnemonic versions, whichever makes sense. So let's look at this one. Boys love ravishing girls like dainty ladies. Great. What it means is B is blood cultures and it's used for sodium or SPS. L for light blue where we use sodium citrate. R for red. G for green. L for lavender. D for dark blue. L for light brown and G for gray. Or you could use the different mnemonics, the driving version, which is stop, light red, green, light go. So stop is for sterile, yellow and yellow cultures. Then you have light blue, R for red, G for green, L for lavender and G for gray. This is basically an easy way to remember the way in which you need to the order of draw is being captured here. Now let's move on to the tube additives and the actions that's needed. The NHA exams heavily test what is inside the tube and what it does to the blood. So this is an easy way of remembering things. The light blue is the additive that's used is sodium citrate, and how you can remember that is the citrate is used for coagulation. See, the C from citrate and C for citrate is for coagulation. Green, the tube, if the tube color is green, the additive used is heparin, and heparin helps heart, which is the stat test. So anything with stat, the heart test, heparin is used. Lavender is EDTA. EDTA is the way you can remember is EDTA eats calcium, so which is basically to stop the clots. Gray is sodium fluoride. Gray for glucose. Glycolysis is basically what is tested here. Royal blue, either it can be none or EDTA or heparin can be the additive, and royal blue is usually used to test for the rare metals or the toxicology. So this is an easy way of remembering what is inside the tube and what does it does to the blood and what exactly do we test from it. Now let's look at the third order, which is the anatomy and the vein selection. NHA focuses on the H shape and the M shape of the anticubital fossa. So the vein selection order is MCB, or you can remember it as my cousin Benny. M for median cubital, C for cephalic and B for basilic. So the first choices is large, stable and least painful. The second choice for obese people is outside like a seashell, cephalic. B is basilic. Last choice close to the brachial artery and nerves. Now another, the heart blood flow is TPMA, toilet paper my assets. So orders of value is tricuspid, pulmonary, mitral and aortic. So TPMA, TIPMA or toilet paper my assets. And the fourth order of draw is safety and compliance. For safety and compliance, typically the tricky questions would be what would you do first? So let's say you have a fire safety related question. The question might be what would you do first? So this mnemonics is going to help you, which is RAISE. RAISE means rescue, alarm, contain and then extinguish. So first aspect would be to rescue and then alarm and then contain the fire and then extinguish it. Or when it comes to fire extinguisher, the mnemonic that you need to remember is PASS. Pull the pin, aim it, squeeze and sweep. So if you remember this particular order, it would help you answer the question, what would you do first? So first is pull the pin, aim, squeeze, and sweep. The third is the patient identification. Always ask for full name and date of birth. If they match, you are ready to draw. I hope you found this interesting and helpful.